our Department of Health representative, Dr. Goggins. He's going to come and provide us with a overview of what's happening and inform us from the state's perspective around the issue of COVID-19.
Mayor Davis, all right. I appreciate the chance to be here. There's obviously a lot going on and a lot of information. Very hard to keep up with for me, and it sometimes has misinformation, so any chance we get to share with all the folks what might be better information and what we know, I definitely want to take that. We'll say that with the speed of this, I will tell you what I understand now, but events are shifting, and so numbers may change, and I hope you'll understand that too. So right now there are no confirmed cases of this COVID-19 in Augusta or in our health district. There are about 31 confirmed cases in the state of Georgia. But I did want to go back just a little bit to say that COVID-19 stands for coronavirus disease 19 because it was the virus discovered in 2019. There are other coronaviruses. Occasionally you may hear someone actually say they've had it because those are cold-causing viruses. There are some that have been with people for forever. But this one is new. It probably jumped from an animal into people and connected with this market in China in December. And we didn't know about this one before that event. And so it's a novel infection. It causes a respiratory illness that is characterized by fever, cough, shortness of breath. But the really good news about it is that about 80% at least of cases are mild. Many possibly even asymptomatic. So it is not that everyone who gets this illness would get very sick. Actually, most people don't. The time from an exposure to getting a symptom is from maybe 2 days to up to 14 days. But there are severe cases. I think we heard that there was a death in Georgia, a first in the state. And so it can get very severe, even though in most people it is not. The folks at highest risk of having the bad cases are folks who are older, over 60, is an age that's commonly stated, or people who have chronic medical problems, heart disease, lung disease in particular. So those folks, if they got this infection, are more likely to have bad cases rather than the milder cases. So I know that everyone has heard all these hygiene messages before, but I wanted to tie them a little bit to the transmission because that's where they come from. The way that this illness is spread is by a person with an infection coughing, sneezing, and then you cough out droplets, and the droplets then could be inhaled by somebody else, or they could land on something and be touched. And the person could touch your eye, your nose. That's the way it actually transmits from person to person. And so that's where these prevention messages that we stress so much come from. We want people to stay away from work or other places where there are people when you're sick. And we want people to cover that cough with a tissue and throw it away because it would catch those droplets and then get rid of them. And that's where the hand hygiene comes from and the wiping down of surfaces. It's all because that's exactly how this illness is spread. Now, there's more specific guidance for prevention for different groups, and you're going to get to hear about that. Some for households, some for workplaces, etc. So I don't want to go too much into that. We'll let you hear that in a bit. And right now, there's no vaccine or specific treatment, and so for people who are sick enough to need treatment, it is supportive. Not that there's no treatment. IV fluids and medications to help symptoms and even oxygen and so forth if needed, right? Those are treatments that are available for people who need it. But there's no specific treatment for this drug, for this agent. So I want to say a word about testing, because testing we hear an awful lot about. Testing was initially only at the CDC, and that was very limited in number. And then about a week ago, the Georgia Public Health Laboratory began testing as it rolled out to other public health labs across the country. And they're running full speed now. That's good. Also, commercial labs, Quest, LabCorp, maybe others, started this week. So they're accepting samples from here and everywhere. So there's now more options for testing. But it has taken a while to get testing ramped up. And so I think that there is a sense that there's more demand right now than there has been supply, but it is building very quickly. And other institutions, hospitals in particular, are getting these tests on board as quickly as they can. This is not a simple test. It's not going to be one that a doctor's office will run like a rapid flu. This is a pretty sophisticated test. It's going to take a hospital, a big institution, or a company to run it. So that's one of the things that has to do with how easy it is to get the test out. So, is there any questions, or did you want to wait on the questions until later?
No, we'll take questions now, and if there's more information that you have that you want to share with us, then we certainly want to have that today as well. Again, I think that was the reason why we asked you to stop by for this town hall. All right.
Yes. You had talked about how a person can contract the virus and the droplets, but how long does the droplet last on the surface?
That's a great question. And for many of these kinds of questions, what I will have to preface it with is this is a brand new virus, and so its exact details aren't really clear yet. But you can make some estimations because there are other viruses in that family, and so you would make best estimations based on those. And what you read is that it can be from hours to possibly longer, depending on the surface and the temperature and the moisture that would be in that environment. So that's why the frequent cleaning, disinfection of the surface is important. It's not like it's just minutes, it's potentially hours or longer. And so the cleaning strategies would be beneficial there.
And I also think that you might have said that about 80% of people may be asymptomatic.
Or mildly symptomatic.
Mildly symptomatic.
Somewhere between those.
Well, even though they are mildly symptomatic, can they still transmit the virus to another person?
We think that people who are symptomatic can transmit the virus. There is a question about whether people who are entirely asymptomatic can transmit it, and I think that will take some additional research to know for sure. It's really the symptomatic people, though, that we would also believe would be primarily responsible for spread. So symptoms are still a really important trigger to take action for us.
And my last question, Mr. Mayor, is how would an individual go from being, say, if I'm asymptomatic, what would need to happen to me in order to infect somebody else with the virus?
So if you are entirely asymptomatic but have it, it's not clear that you could transmit it at all.
Okay. All right. Thanks, sir.
Commissioner Song.
Thank you, Mr. Mayor. Dr. Gargan, how you doing, sir?
Very well, how are you?
All right, sir. Been hearing, ever since we've been discussing this nationwide, we've been hearing about if you feel in any form or fashion that either you contracted, just say for instance, like Tom Hank and his wife just admitted that they think they've tested positive. But I'm hearing very little about what to do behind the closed doors. If anybody to stay home, what have you. What are your suggestions that they do?
So if the first first part of your question, I think, was that if someone has some symptoms.
The symptoms are, in Tom Hanks' case, is still, somebody's still not saying, what are you doing behind those doors? I mean, what are you taking care of yourself?
Well, so the first part of that is, if someone has symptoms and they feel like that they want to be evaluated for this illness, minding that these symptoms would overlap a great deal with flu or other or cold viruses and things like that, they really should get an evaluation by their healthcare provider. And what we ask on that is to call ahead for anyone that you would go to see, to let them know that that's what you're interested in. They may be able to do something over the phone, and they may be able to give you instructions about how to come in best to be evaluated. And that is where you start to decide if maybe this is something else, maybe it is this and needs to be tested, but an assessment would have to be done as the first point. If someone has this, and it's very, let's say it's mild, then, and they're at home to avoid spreading it, which is good. Really, the things that you would do would be other things you do for a mild viral illness. So get rest, lots of fluids. You can take things for fever if you have one, it makes you feel better. And I think someone was joking at another meeting, how about soup? Absolutely. So just normal viral care at home. It's really being home and not spreading it that's the most important part of that.
Okay. Dr. Goggin, on the south side, we have we have a tax office there in the South Augusta, and we have a utilities. One deals with our water bills or whatever, then we have a tag office there, a joining building. A doorway separates those two. They deal with the public habitually, 500 or 600 people a day, each one. If one of the staff members got sick there, was diagnosed positive with the virus in the workplace, would that concern you? What would you suggest? So
if someone is diagnosed, I can tell you generally, because it would apply to that case or any other, at this point what happens is those positives are reported to the Georgia Department of Public Health. This is now a notifiable illness. So any positive diagnosis must be sent in to public health. And then we would do an interview with the person and try to find out close contacts. Not everyone that they've seen, but someone that they've been close enough to in time and space that that person might be at risk. And then we would make recommendations to those folks about who would need to be, say, out of quarantine to watch and see if they got sick, or who didn't need to take any other actions. So it's really based on an investigation and the specific circumstances once we find out about a positive case.
If you got notified immediately about that, let's just say this happened this evening, you got notified this evening, first thing in the morning, how long would it take you to make the type of assessment that you just talked about by getting to the nuts and bolts of who's been in contact? What's that timeline for you?
Well, I can tell you that we've ramped up quite a bit in preparation for this. We obviously haven't had to do it, but our staff, is one of the things we've been doing is coordinating if we were to have to do that so that we can move quickly. This would be led by our district epidemiologist, but because we thought there might be lots of folks that need to be called and so forth, we've got a team ready to do that. So if that happens, we would be well into it by lunchtime.
Tomorrow?
Yes, for one. Sorry.
Thank you, sir.
Dr. Governors, you have more to share with us. We'll take some questions. I mean, again, town hall format. If there are questions from those of you in the audience, we want to make sure that you get a chance to ask those questions. All right, Commissioner from Fenoy, again.
Yeah, if a person feels like they have virus, is there a hotline they would call, or would they call the doctor's office, and rather than have that person to come to the doctor's office or the emergency room or prompt care and put everybody else in that area at risk, is there a specific or one location that we could direct the person to minimize the risk of that person infecting other people in case they are infected?
So there's not a single number, but I would also say I agree with you 100%. You're correct. You want to be very careful about people going into a healthcare setting if you think they may have an infectious illness. That's why calling ahead would let you figure out how to do that without putting anyone else at risk. You wouldn't expose anyone else who was there, including staff or other patients, and that can be worked out ahead of time, rather than just showing up and then they'd have to figure it out on the fly. So that's why I do think there isn't a single point of entry, and since what you need is an evaluation, an assessment to decide if that's what you may have fits this picture or a different picture, that's why we were recommending that the healthcare provider is the first point of contact. Maybe I just add one more thing then. No, I would stress there's lots of information out, but there is the misinformation, so I really would encourage everyone to try to get your information from the most reliable sources that you can. The CDC website is the #1 site for the federal health side response, and the Georgia Department of Public Health website and our district website have more local and state information on it. And so for questions, please try those first.
All right, thank you. EMA Director James, you got some things you want to share from a workplace perspective?
Mr. Mayor, Commissioner, and public, and some of the questions that we have received, how do we deal with this in the workplace? What do we do with employees? We want to, inform everyone that we're definitely pulling our information from the CDC. We're following our pandemic plan. It is working right along with the state's plan as how we need to address this. And so that information you can read for yourself if you like. You can go on the CDC website, and they have a section for coronavirus 2019, and they have that section where you can go through and you can gather some of the same information. Some of the information that we will be putting out locally throughout our government, we're going to reach out with risk management and work with them. Also, we'll probably ask some of our private employees to do this as well. We're going to ask folks to probably rank their employees. So based on a certain criteria information, you have 4 different rankings. You can have employees that are considered very high exposure risk, high exposure risk, medium exposure risk, and low exposure risk. Now, your high exposure risks are going to be your healthcare workers, your doctors, your nurses, people of that nature. Also, your very high and high will be your public safety people will be considered a high exposure risk. Those that work on the ambulance, those that work on the law enforcement officers, firefighters that go out and deal directly with people that are sick. Most of our employees, we feel, in our government are going to fall under the medium exposure risk. Those are your employers that have frequent, we have, as Commissioner Son just mentioned, our Utilities Department office, the tax commissioner's office, where you have a lot of people come in, and they come within 6 feet of the workers, the people that work there. And so these are categories that can be considered at the medium risk, and we both have administrative changes and engineered changes that can take place. So an administrative change would be a policy change, putting up posters, doing some of the things that our risk management department already has done, and we may be asking that we increase that education so that employees know what to do and how to keep themselves safe. Some of the engineered changes would be your air handling systems. If we could look into, is it possible that a different type of filter in the air system would need to be used, or definitely in the case where you have the public coming in and you have someone that deals directly with the public, what kind of barrier would you need to have in between you and that citizen so that if someone sneezed or coughed, it would not actually get on the employee itself. your low-risk employees are those that don't really engage with the citizens within 6 feet. We do have several of those that work out in the community doing certain things that they don't necessarily come in frequent contact with the citizens on a daily basis. And then we would encourage them to maintain with the education that we've already done. Keep your hands clean, you know, do a head nod. You know, people stop kind of, they don't even bump fists no more, they just kind of head nod, you know, hey, what's up? That's kind of the kind of education that we would want those individuals to go forth with. So what we will be doing shortly is asking, especially within our government, for our department directors to go ahead and look at their employees and evaluate them based on the guidance that we will get it out, but they can also look on the CDC's website and kind of categorize their employee, and then work with us, risk management, probably have to do some work with central services and determining what kind of measures that we need to assure taken so that we can keep employees safe.
I know, again, it was important for us to have this initial conversation, just to communicate and to let everyone know there's been a lot of discussion ongoing in the community, both with our local, state, and federal stakeholders with regards to Augusta's response, if any need to be with regards to this. One of the most important questions is, what are we doing internally? And I think as Director James has just indicated, these are some preventative measures that are being taken. I think several of you may have gotten a handout. These are things that have been talked about and thought through from a proactive or preemptive standpoint that you see. Public health recommendations, all in concert with not only the CDC's health guidelines, but best practices that other cities are employing as well. I think what I've unequivocally heard more than one time, whether it be from the Department of Health here locally, but also our hospital CEOs, is that there are no confirmed cases of COVID-19 in Augusta. We want to do everything we can to mitigate and or diminish this fear and anxiety that our residents and our employees have, that there are no confirmed cases in Augusta. And that's extremely important for us to make sure that we're communicating consistently across the board to our employees, to our elected officials, to our family members, that there are no confirmed cases of COVID-19 in the community. From a workplace standpoint, I do want to make mention of a few things, particularly as it relates to the handout that several of you have and that we have made available. And that is from a workplace and business standpoint. The things that you see there in terms of what can and should be done, or in the event that there were a positive case, how we would respond. Today, we are taking the basic precautions that the Department of Health and the CDC have provided us with. Our administrative staff, McDowell, McDonald, and Sims have been thinking through and working with our directors about Augusta's response in the event that things were to need to be done. One of the things that is basic but also very critical, and a member of the media recently asked us about this, is about the sanitizing stations, the hand sanitizing stations. And we have already been taking proactive steps to deliver those. I'm going to ask Ms. Dowse if she'll come up and talk about that just for a brief moment, about what we've been doing proactively in advance of this meeting. Quite frankly, it's been in the works for several weeks.
Good afternoon. Central Services ordered 11 hand sanitizing stations about 4 weeks ago, of which 5 of those have already been delivered and have been placed. We put 2 in the municipal building, 1 downstairs in our lobby for those who enter and exit, and there's also 1 on the 2nd floor right outside of the commission chambers. The other 3 are for the Judicial Center, 1 also in the lobby, the 2nd on the 2nd floor, which is where court is held, as well as on the 3rd floor, which is also where court is held. We have increased our cleaning process with all of our custodians during the day as well as at night to a total cleanse, which means We clean the surfaces first and then disinfect them with the surface to remain wet for approximately 10 minutes, which studies have shown and have proven that with the cleaning products that we use, that this will aid in total disinfecting and then cleaning up the surfaces.
Yes, want to ask Chief James a question.
Yes, sir.
Chief James, one of my concerns is our senior citizen facility. And that at any given time, we may have 50 to 60 people participating in a daily senior program. And since the ones that are my age, because I frequent those facilities, are the most at risk, what are we doing to protect them? And since we are most likely to get it, we have employees that are working with the seniors. So what do we have anything in place?
And that, Commissioner, that took a lot of discussion this morning and yesterday as we were reviewing the CDC recommendations, because some of the vulnerable population, they're recommended that they kind of stay at home, stay kind of isolated, and the number that was presented was, in crowds of 50 or more. And then I myself said, well, I just told Ms. Jones she won't be able to go to church, so that might not really work. So what we're going to do is really try to get with our recreational centers to really talk about how we're sanitizing and use that as at this point, an area where we can educate and actually maybe teach and show those seniors, this is how you sanitize, this is how you sanitize while you're out in public, this is how you sanitize at home. I think at the juncture that we are at right now, that's just an opportunity for us to increase our education. I don't think we're at this point prepared in Augusta to tell our seniors that they can't go out or they should not go out. So I think at this point we need to very much use it as an educational opportunity to assure they understand what steps need to be taken to keep themselves sanitized and clean.
And I got a question for Ms. Dowd. Thank you, James. Ms. Dowd, so are there any plans to put hand sanitizing stations at the senior facility?
There are.
Okay, thank you. That was easy.
Absolutely. All right, Commissioner Hassan.
I just want to go back. This is from the initial. I think this is important. It's on the thing here. Just having to see it. It's one of the bullet points. It says, and I think you probably will respond to this one. It says, when it's urgent employees to stay home when they are sick and maximize flexibility and sick leave benefits. The bullet point beneath that, it says, do not require the doctor's note for employees who are sick. In this environment, would you elaborate why that's so important?
Yeah, I think that's extremely important. And again, we talked about this earlier as we've been kind of navigating through what would Augusta's response be in the event that we had individuals who would show up, who were sick, who were experiencing similar symptoms. We don't want to add to the anxiety and angst. And one of the ways to do that is allow folks to go and be seen and to get the appropriate medical care that they need. And I'm going to yield to Deputy Administrator McDowell to kind of speak to that as well, because this is an important matter that they talk about in regards to that.
Thank you, Mr. Mayor.
Yes, Commissioner, to address your question, we've had a series of discussions this morning as it relates to some of these matters, and so our plans in terms of administrative staff is to get with our directors tomorrow first thing and go over some of these measures that we've sort of laid out. We haven't had the opportunity as of yet to sit down and to develop a more robust strategy in the event of. I think it's important for us to continue to reiterate there's no tested positive cases thus far, but we are planning on putting all these measures in place to be more proactive and preventative in nature as possible. But this is one of the things that we highlighted that in the event of, we would ask that we have unanimous support from the body in terms of us relaxing some of our policies, and one of them is that if someone is tested positive, we're not going to require or someone feel like they have the symptoms and need to stay home, that we're not going to require them to have to follow up with all the doctor notices and notification that's currently in our 3 p.m., but to allow them to take precautions measures as possible to protect the rest of the workforce.
Also, Mr. McDowell, it also pertain to our employees as one of the care providers, because it's known that if, just say for instance, my wife got sick, and I was supposed to be at the commission meeting, I was going to stay home. I may end up catching it as well, but I'm going to become the provider of the service care that I put down. So we're going to consider them as well.
Yes, sir, absolutely. At this point, our main emphasis is to protect the entire workforce as much as possible. So if one feels as though they have the symptoms or someone in their household have the symptoms, we urge them to stay home so we can protect the rest of the population.
I'll also add to that, Commissioner Son, that in thinking through these on page 2, under number 7, really your last couple of bullet points, when you talk about preparing for possible disruption caused by an outbreak, some of our preparedness actions are the following. I know the tax commissioner had raised a series of questions earlier today, but these things can be employed at home as well in terms of how we handle the workplace, how we handle home, and how we handle school. And so with direct response to your question, in terms of making arrangements about how your family will manage a school closure in the event that we were to find ourselves at that place, but also how you care for your sick family member without becoming sick. But in the event that you do, we want to make sure that we're accommodating that as well.
Thank you, sir.
Yeah. Okay. Any questions from the audience? Any questions from the audience? Any comments?
Yes, Mr. Mayor.
Yes, sir.
I got a question from,
When you're speaking to the microphone.
I'm sorry.
Yep.
Maybe Dr. Goggins. We got a question from a constituent. I know we were live. Let me try to get back to it.
I will take that.
Yeah. It's, I know you're in a meeting, I'm watching it. My 5-year-old had the flu twice, once in January, again in February. She was home in February 2 full weeks and she had viral conjunctivitis. She had to see an eye specialist. Her fever was 104 for days. Our babies are vulnerable at school. Can the school consider closing allow us to keep our kids home without feeling it until this blows over? That may be a bit much at the end of it, but can you take some later part of it? I'll read it again if I need to.
So, I guess a couple of things that I would say about that. One of the things we've seen over this particular infection, just focusing on this one, is that kids, fortunately, seem to get very mild illness. So, whereas as we've already said, the older folks and folks with chronic conditions are more likely to have those bad cases, kids rarely have bad cases. They almost all have mild cases. So that's good. Kids can help spread infections as we know. But right now, we're following CDC guidance, and that is, as you've heard already, some cautions for people who may be at higher risk, but we're not talking about the closure of events at this point because of the situation that we don't have active cases in our area, and we don't have documented community spread here. So that guidance is really just the individual precautions and then some special precautions for people at high risk. And that's based on just what we're seeing in the community.
Does it concern you at all? I know she's never been to a doctor for sure, but from what we're looking at here, they have the flu back to back like that in a short period of time. Does that concern you?
Well, so this year, I mean, I'm sure the flu is miserable, and to have it twice is especially bad. But this year we had a pretty moderately bad flu season, and we had flu A and flu B, which are two different types that came through almost in two waves. And so there are some people that ended up getting more than one flu just because of the way it spread through the community this year. It doesn't do that most years.
Thank you.
For those of you that are watching online, I'll offer the following phone numbers for you to text your questions to 706-564-9370. That's the commissioner from the 6th. Or I mean, this is the teletown hall, right? So you can text your questions there, or you can text to me directly, 706-955-6988. 706-955-6988. And we'll take your questions and pose them to the experts. Commissioner?
Yes. With this virus went national, I think our airport director had some concerns about the virus and the impact that it could have on the operations of the airport. So I would like to ask him whether all of his concerns have been addressed, and is it safe to fly?
Thank you, Commissioner, for that question. It's very fluid, as you know. I mean, not just in the airport and aviation, but in general, very fluid. I had a meeting this afternoon with a lot of our partners. As you may know, back a couple of weeks, I guess it was in late January when the epicenter was in China, in the Wuhan region. We had flight restrictions coming out of China. So what happened is that any aircraft that originated from China or any individual that was on an aircraft that happened to go into that particular region, they were diverted into, there are 11 airports that have screening capabilities. So anybody that were in those particular regions were diverted to these airports to be screened. So that was one of the first steps that happened. We had a secondary travel restriction about a few weeks later for Iran. And then, of course, last night we got that third travel restriction from countries in the EU, with the exception of the UK. So we're kind of digesting all of that. This, again, from last night, the third travel restriction goes into effect at 11:59 tomorrow night. From what they're telling us is that U.S. citizens who are allowed to travel, but if they're within that, if they've been exposed or within that 14-day period, that there will be 14 screening locations that will be designated for when people enter into the United States. So I have not seen what those 14 stations are yet. We're still trying to find out what those 14 stations are. The airlines, and again, this has been on the media, the airlines have cut a lot of capacity, so they've cut, we're seeing, and it varies from airline to airline, but we're seeing 10 to 20% of capacity cuts in domestic capacity. We're seeing upwards of about 60 to 70% for flights going into Asia Pacific region. We're also seeing large capacity cuts into the European region, so we're seeing that throughout the industry. Airlines are doing intensive cleaning on their aircraft, so at a lot of especially the large hubs, they're doing extremely intensive cleaning, but that also trickles down to some of the smaller airports, but some of the spoke airports as well. So even in Augusta, we're doing not only the aircraft, we're doing additional cleaning, but we're also doing additional cleaning in the terminal. So my folks are doing additional cleaning, hand sanitizing stations. So just a lot going on. It's extremely fluid. So that's it, unless you have any other specific questions.
I just wanted to reassure the public that, you know, our airport is doing everything it can do to minimize the risk of the people that come through there contracting any kind of illness or disease.
Yes, sir. Yeah. Okay, thank you.
Thank you, Mr. Judon. Our airport has been a part of other meetings and conversations. They are very proactive in their response to this. We have a series of questions that have come in by way of live stream. First question, good afternoon. Should we stock our homes with food, water, etc.? Question 2, will virus cause a government shutdown? No. We are operating at full staff at this time, and we will continue to do so until such time that there is a reason to do something differently. That would trigger full implementation of any of these public health recommendations from the CDC. And the role of government is to provide for the health, welfare, and safety of all of our citizens. And every single day, those 2,700 plus employees are essential to delivering on that. From parks and recreation to public safety to law enforcement to fire protection to engineering to utilities, i.e. water, to environmental services, to procurement, to information technology, to all of these departments that make up this organization with phenomenal people, to include the judiciary and what they're doing there. It is vitally important for those folks to be in place and working. So we will not be shutting down government. We have a vested responsibility to provide for the health, welfare, and safety of all of our citizens. And we will be committed to doing that every single day, even in the event that there was notice of a positive case in this community. We will continue to do that. Finance, all of the departments that make up, again, the city of Augusta. Question number 1, I'm going to yield to our friends, Dr. Goggins, Chief James. From the mayor's perspective, I do not believe that any citizen in Augusta needs to be doing anything extraordinary. There are no confirmed cases. We should, again, take the basic health precautions as we would do any day with making sure that we wash our hands, keeping our hands out of our face, making certain that we have hand sanitizer both at home, at work, in our vehicles, in this transitory mode that we oftentimes find ourselves in. But again, going out, buying up all of the masks, buying up all of the tissue, no, it's not necessary. It is absolutely not necessary. All right, do you want to respond to that same question?
Yes, and GEMA has always asked on the, if you look at the Georgia Ready program, we've always asked the citizens to have, no more than 3 days. They need to have 3 days of supplies at home. It is not necessary at this point to go out, or at any point, I guess, to go out and buy up all of the N95 masks. There is a issue with first responders, ambulance services, fire departments, being able to purchase those necessary PPEs for their own employees. Even some hospitals are having some concerns. So if all the citizens go out and purchase up all the N95 masks, it makes it very difficult for those first responder agencies and hospitals and doctors' offices to get them as they need them. So we would not advise that you go out and purchase up all of the masks and all that type of thing. We would encourage 3 days of medicine, 3 days of water, 3 days of food.
Thank you. All right, that's Mr. King.
Thank you. I wanted to ask the expert, I'm sorry I didn't get his name. I don't remember his name. Dr. Goggins. Dr. Goggins. Some of the things that have happened in the last few days and the reactions some organizations have had to infections have caused confusion amongst the public. I speak more specifically about, of course, what some of the entertainment folks have done as it relates to the NBA. But what has happened with the school systems in Atlanta, and because of an infection, shut down the school system. Mayor Davis just spoke to government's role as to health, safety, and welfare, and government will always be open. Frankly, in the tax commissioner's office, we just do tags. We don't do health, safety, and welfare. And so with that comes a responsibility of me to my employees, that if there's an infection, how do I protect them as well as the public? So my question becomes, which mentality is the correct mentality for a government that's trying to decide what to do? We fall in an area where if someone comes in and infects someone in my office, and the number of people that come in all the time, we are close and shoulder to shoulder every day. And while we want to stay open and provide services, and the utilities department and Mr. Wiedemeyer and I have already discussed how we can do that, possibly through the driving service. So we're working on that. But the messages are mixed. Some places say shut down a system because of an infection, and then you have, we've got to go on. So what is the answer? Which one works well? Because I've got employees asking me every day, do I have to take the money that the man just sneezed on? That is an issue.
So there's a good bit to unpack there, but the first, the direct answer to the question, I think the things that Chief James gave some of and that the county's working on is the absolute right approach, the risk stratification. What are the risks of the people, not as a whole, but specific to what they do? And then the responses are custom, they're tailored to that. That's the right way to approach handling risk in these situations, not something blanket, but really assess each individual place. And so that's the system he was speaking of, and that I think is absolutely right. I think there's no need to panic, and in some places you read about in the newspaper, you do sense that there is some, and I hate that because it is a mixed message. I think it's the wrong message. I think, although we have to I don't want to second guess people's decisions, they may have other considerations, but I think the guidance that we have right now is consistent with the CDC, with us, and with the evidence and where we are. And so I'm very comfortable with it. And then the last thing I would say is one of our jobs and what we're doing every day now is communicating with our partners and getting ready. That includes government, private, healthcare, all sorts of partners, to talk about plans and just make sure we are ready so that we don't have a decision made without consultation, so that we make the right decision for the public and protecting it for themselves.
Okay. And that was part of my concern, and these ladies and gentlemen that are on the commission have a tremendous responsibility to protect not only citizens but employees who work here. And I just think that one positive, and without a plan for what to do with that positive, creates the hysteria that we're talking about. And so what we're trying to do, at least in my, as Ross says, on my side of the wall, is try to figure out a way that if something happens, what are we to do to continue to provide a service? And I know this is what the very same thing a lot of the departments are talking about as well, because a lot of them talk to me about it as well, just in conversation. What happens when it happens, even if you're inside and you don't come into contact with the public every day? We're all coming in contact with each other. We're all in this room together, and I don't know that any of you don't have it right now, and thus 14 days later we have a problem. So we're just trying to figure out what the plan is, how the plan works. Again, it's a tremendous responsibility, and I'm glad we're able to have this conversation, at least to start to talk about it, so the employees can gain some confidence that we're thinking about them as well. So I appreciate you. I appreciate your answer.
Thank you, Mr. Kendrick. I want to add a few things. There are a host of questions that have come in to Commissioner Hassan and certainly to myself. This is a fluid situation, and we are being as responsive. One of the things that I can say unequivocally about our community is that we've got the very best medical facilities in the world, from Doctors Hospital to AU to University to the VA facilities here in Augusta. We've got the very best. They are working in concert with the Department of Health. They have already gone through a series of preparations to make sure that in the event that we have a positive case here, that we know how to not only respond to it, but what the protocol is. And the overarching question is, what do we do internally in the event that we have an employee, family member, etc. We're going to follow those same healthcare protocols. We're going to call, we're going to go in advance. In fact, one of the recommendations of the CDC is to call your healthcare provider in advance so they can provide you with supportive help on the phone in advance of you arriving in the emergency room, further exacerbating what very well may be a potentially positive situation. And so with that, I'm going to go to the commissioner. I'm going to very quickly. We had a question from First Baptist. What do places of worship do? The CDC.gov website has a host of recommendations for places of worship. We will certainly be pushing that out to our faith community in Augusta, Georgia. But if you go to cdc.gov, they have a host of resources that are readily available with guidelines, social media stuff you can push out as well. So that's available. And not only did we have that question, but we had another question with regards to you have, again, I'll defer to Dr. Goggins. My daughter has an immune deficiency and asthma. She has a history of having pneumonia multiple times. Should I take it upon myself and just keep her home from school?
So for that one, really that person does need to consult with their doctor care physician, because we can make recommendations for communities, but when people have very particular needs, their own healthcare team is going to be the one that's going to know their situation and what to do. I would reach out. I would recommend to that person to reach out and try to get that conversation going and get some guidance there.
Commissioner Hassan.
Thank you, Mr. Mayor. Mr. Mayor, I got two. These are about activities. One is, has the city been in talk with Augusta National about postponing the upcoming event? And the second one is more about the parade. The parade this Tuesday. Is there any conversation about postponing it as well?
So there have been a series of conversations, again, in the previous meetings that we've had with the members of Augusta National. Those meetings were all the way up to this past Tuesday. There have been additional conversations that I'm aware of that Augusta National is having with other stakeholders and partners, to include our governor's office and others. We are not prepared to speak on their behalf at this time, but I know that they are tracking this situation. In reference to the St. Patrick's Day Parade, we have been in conversation with the lead officials for that. And after this meeting, based on this town hall conversation, we were going to provide them with a follow-up call based on what we've learned and what we know. And we'll be providing a recommendation in terms of what will happen, and you'll know that today.
Comment as well.
Yes, sir.
I mean, as we talk about something being fluid, I mean, it doesn't get any more fluid than what we witnessed last night with the NBA. I mean, the stadium field, they're about to tip off. And they don't cancel the game, they cancel the season. Postpone the season indefinitely, until they get a better handle on it. So that's the space that we're in, and we have to be mindful of that, and we encourage the media and everybody else to be mindful of that. When they was concerned about and I'm saying this because they were concerned about the notice. And I was talking how fluid the situation was, and as a result of that, how they get any plainer than what we witnessed with the NBA last night.
Yeah, I couldn't agree with you more, Commissioner Hassan. And again, serving as the president of the National African American Parents Association, I was on an emergency conference call on Monday. We were continuing forward with our annual conference in Atlanta, April 22nd through the 24th. As of last night, we have postponed that until September. That's how fluid things are. I think I had a question from George.
Mayor's Masters reception, that is something you would control, the city would control, would have to go to Augusta National. Is that still on?
We had conversations earlier today. We are planning on, again, out of an abundance of caution, but with understanding, to make that determination not later than tomorrow. I want to reiterate, there are no confirmed COVID-19 cases in Augusta. Anything that we do will be a precautionary measure
and only that, a precautionary measure, so that we are allowing federal, state, and local governments to get the resources in hand to not only be able to do testing, but to then be able to do that rapidly and provide a response to those individuals who potentially might have a positive confirmation. That is where we are. And so, again, if we make decisions that those events are canceled or postponed, it will be only upon that basis, out of an abundance of caution, because we don't have all of the resources in place to address that. Any other questions?
Yeah, I got it.
Commissioner?
You know, when I was in the workforce, I used to get very angry when people that were sick come to work and be coughing and sneezing all over everybody. That was before the coronavirus came out. But I would like to encourage people that are sick. If you're sick, I mean, you don't have to have the virus, but if you're sick, stay at home. Because what ended up happening, you know, if it's the flu, if it's a bad cold, you don't make other people sick. So, if you're sick, stay at home. And that includes my colleagues. So if you're sick, don't show up.
All right. Administrator McDowell, do you have any comments? So we're going to close with Dr. Godwin to give us final comments at our town hall. Any comments?
No, Commissioner, Mayor. The only thing that I will alert staff is tomorrow morning we're planning on having myself and Deputy McDonald a follow-up with staff, the directors, and we will go over a more robust strategy on how we're going to implement in the case of. I don't think we'll be exercising due diligence if we didn't have this conversation with our directors and allow them some input in the process and what we plan on laying out. So in the morning, there will be a mandatory meeting for all our direct report directors, and we will go over our strategy moving forward. And at that point in time, they can disseminate that information down to the rest of the employees.
Again, I just wanted to thank the Mayor and Commissioners for the opportunity. Obviously, there are lots of questions, and I hope that I was able to answer some, we were able to answer some, but again, to sell the CDC site is really a great site. Those group specific, so what do I do if I'm from a church? What do I do if I'm from a business? They have it broken down that way. You can go there and find your specific need, and I would really encourage everyone to do that. And I hope that everyone sees that we are all working very hard to be ready should this come up, so that we will be able to keep everyone in Augusta healthy. So thank you again.
Thank you. Thank you so much.